I am Dr. Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Welcome to CEO Live Talks. I'm your host, Dr. Jett. And today I have a great friend with me, Ms. Livingstone. She's going to tell you a lot about what we do together. So before we get started, as I customarily do, tell me a little bit about yourself and your upbringing.
Well, I've been a licensed massage therapist for over 16 years.
Mm-hmm.
I'm trained in work called structural integration, and that's looking at the body as a whole and looking at alignment and posture and gait to unravel a pain pattern for someone so they have more mobility. I was born in Arizona. My family moved to Kentucky when I was 4 years old.
Okay.
And
What part of Kentucky?
we first came to Louisville. And then my father passed away when I was young, so we were in LaGrange.
Okay.
Yeah.
All right. So how was LaGrange growing up?
Well, it was, I always complained to my mom of, it wasn't so easy visiting friends,
Mm-hmm.
We had to drive further
Mm-hmm.
to get places.
Mm-hmm.
And so, I was always like, I want to play with my friends. And really, I just had to come up with creative ways to entertain myself. But I had a big family.
Okay.
So we gathered every single week traditionally on Sundays.
Mm-hmm.
We'd have a big family meal, and we would all pitch in and do stuff around the house and help my mom. So
Okay.
I have a lot of brothers, actually.
How many brothers you have?
I think I have officially 6 now. A few have died.
Okay. All right.
Unfortunately, many of them were adopted.
Okay.
And so they were much older than me. So they were more like, much older brothers or uncles.
Adopted. So your mother loved to adopt kids.
It was really my father.
Okay.
He was born in 1920. So
Okay.
he was older than my mom.
Right.
And he had a huge heart. And, he came from a really challenging background.
Mm-hmm.
So he led a life of service,
Okay. And challenging background by what means?
He was given up. He was literally placed on the steps of a church when
Okay.
he was born.
Okay.
He was in and out of foster care.
Mm-hmm.
And back then, which maybe it actually still happens now, he was really abused by different families
Mm-hmm.
and abused him for his labor and other physical abuse. And so he basically left his last family when he was 13 and
Okay.
dropped out of school
That's young.
very young,
Okay.
and so this was in the 30s.
Yes.
So things were
Quite different then.
quite different then.
Great Depression.
Yep.
Was happening around that time frame.
Yeah.
Okay.
Yeah, so he lived on the streets for a time. He had a lot of different failed businesses and attempts at trying to be an entrepreneur, and worked in a mental institution actually,
Okay.
and different things. So it was later in life where he had a real transformation and wanted to really help people and devote himself to helping people.
And so what did he end up doing in terms of career-wise?
He was a
Because
teacher.
he sounds like a very extraordinary person.
He was extraordinary. He really was.
Right.
He was a teacher. He actually ran a nonprofit at one
Okay.
point. He
Okay.
opened community centers. He helped people launch businesses that were successful at the time.
Okay.
So, yeah.
And so because of that, and because of the things that happened to him, made him adopt a lot of kids and try to undo the things that happened to him, in a sense.
Yeah. I think that he believed in healing is always possible.
Mm-hmm.
And
because of that dynamic, your mother had to, of course, deal with him bringing some more kids home. How did she deal with that?
I think my dad drew the best out of her, and she was already an amazing person.
Mm-hmm.
But he really pushed her to be even stronger,
Okay.
and to be to forge a deeper sense of love for herself and for them,
Okay.
for the family. So
That is interesting. So how, because of somebody taking care of, all your brothers, how did they end up?
how did they end up?
Mm-hmm.
Oh, my brothers are the salt of the earth.
Okay.
Wonderful
Okay.
human beings. Will help anybody.
Well, the reason I ask the question because, you have somebody pouring into you and, giving you that love in a nurturing environment. I would anticipate that they would be a selfless service type person, right? Because that builds character. So
Yeah, absolutely. Yeah, they're the kind of people that just work hard. I mean, that was like a big ethic in my family, is being hardworking, and seeing where there's need and taking responsibility. And if the counter is dirty, clean it.
right.
We all pitched in together and we all helped each other. And my brothers really banded together, and my family had a whole different way of being. I mean, we would have a whiteboard sketching out how are we going to get the bills paid. My mom was very open about challenges and how do we actually work together to come up with solutions. So like all the needs are met.
That's good.
Yeah.
That's a different way of parenting. I would tell you that much.
It is. She was unique. She was.
Because to put that on a whiteboard and say, how are we going to get this done?
Yeah.
I mean, usually the parents don't involve the kids and they just, I find a way to take care of it, or I work more jobs or whatever.
Yeah.
So that's different. Okay.
It was different.
So when you decided to go to high school and go to college, what made you take this direction?
Oh, becoming a massage therapist and
Yeah.
getting into this kind of work.
Yeah. What did you do before that? Because you have an interesting path.
Yeah. I studied anthropology,
Mm-hmm.
and I wanted to get into conflict resolution. I had a whole job working with immigrants and refugees at a nonprofit in North Carolina.
Mm-hmm.
And really, I got involved with body work because of my own experience of sexual assault and recovering from that.
Before we go there, because anthropology, I have a friend, Dr. Victor Wilburn, that studies this, and it's all about human behavior, right?
Yeah.
So in studying human behavior, did you decide to go overseas at some point?
I wanted to go overseas, and my path didn't go in that direction.
Okay.
So the original vision was going over to Azerbaijan
Okay.
to work with refugees that were in this particular town, and my path did not lead me there.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at DuValle Community Health Center. Ever since I started at DuValle over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at DuValle Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
Hi, my name is Farron Jackson. This is Shakoya Gurton, and we're both medical assistants here at DuValle Women's Health. We specialize in pregnant women, mammograms, ultrasound, and any vaginal complaints. So we offer free pregnancy tests. We offer glucose testing for our patients who are 27 weeks pregnant. We offer mammograms if they need one, if they find any lumps in their breast, and we also offer ultrasound if there's any abdominal pain or a pregnant patient. It's important for our women to keep up with their bodies, because if they was to have a lump in their breast and they don't perform monthly, everyday breast check, it could be a lump there that may need a mammogram, and we could catch it just in case it's cancerous. You can contact us at pdchc.org, or you can call 502-774-4401, extension 1142.
You got out of doing anthropology, and what steered you to doing what you do now? Walk me through that incident.
Yeah.
And I know it was very traumatic, so.
Yeah. So I mentioned a little bit ago that my dad worked, one of the places he worked was in a mental hospital.
Right.
And, you know, back then there was a lot of abuse of
Right.
patients, and mental institutions were more like prisons. And he was more of like an associate, just to assist with patients, and he observed a lot of different things. And so one of the things that I grew up with in my family was, if you have a problem, you do not go to a mental health counselor.
Mm-hmm.
You do not go to mental health services, because they will steer you in the wrong direction,
Mm-hmm.
and they will not provide healing for you. And so, you know, I had a direct incident of assault, and my symptoms of trauma surfaced years later.
Mm-hmm.
And, you know, there were barriers into seeing traditional counselors, but there were physical symptoms manifesting. And so I was connected to, my mom sought alternative means,
Mm-hmm.
and connected me to a nurse who connected me to another person who did a lot of hands-on touch.
Mm-hmm.
And it significantly improved improved how I could show up in the world and decrease symptoms that I was having.
So walk me through, because that's a lot to unpackage. Walk me through the assault. Like, what actually occurred?
Well, I was raped,
Okay.
if that's what you're,
Yeah,
you know.
I'm
Yeah.
trying to figure out what the symptoms were and what incident triggered it.
Yeah, so that was an incident that occurred, but
Okay.
you know, I think that there's also a series of, you know, just being mistreated as a woman by men, which I think is so common for a lot of women. Things that just seem so nonchalant for a man to do, but have a very deep impact. And when you sustain that like multiple times over and over again, it starts to also become stressful.
Oh, I can imagine. And when you say you started to show symptoms, what actually occurred that became noticeable to your mom?
Yeah, I was crying a lot.
Okay.
I had a lot of anxiety. I had a lot of insecurity. I had a lot of shame. At one point, I would wake up in the middle of the night and I felt like hands were touching me, but no one was there. So there was a lot of discerning what was real and what was not real. And I think that my mom was so grounded and really, she had so much love that poured out of her. And I remember crying to her and just saying, I don't know what's real right now. And I remember her hugging me and saying, my love for you is real. And so that was very, very powerful. That brought me out of that kind of mental state.
So,
if that makes sense.
No, it makes
very,
sense.
very
So,
powerful.
how much longer after the incident did you start to show symptoms, or did you sort of push things aside and said it wasn't real, it didn't happen?
I pushed it aside.
Okay. That's what I was kind of assuming.
Yeah, I absolutely pushed it aside and didn't want to talk about it,
Right.
and got involved with drinking, and
But that's perfectly normal.
yeah, very, very normal response, and just did whatever I could to kind of, it is
Right.
not there.
Right.
And then it just bubbled up. You can only do that for so long.
Right. You only could do this so long.
Yeah.
Did you report it?
No.
Why not? Because I know sometimes people don't do it because it brings shame, in a sense, or embarrassment, and they don't want to do that.
I think I just didn't want, I didn't want it to be pulled up again. I didn't want to have to talk about it. Honestly, like I didn't want to acknowledge that it had happened. That was
Sure.
part of my ability to disassociate from it and disconnect from it.
But that would be hard because, first of all, if I think somebody did something to my daughter, or somebody actually attempted it to one of my daughters, I would assume they would want to hurt the person. First of all, they're going to see him again, and they have to deal with that part, right? And then they're going to tell somebody if they can't do something, right? Because that's a normal reaction.
Yeah.
So why did you choose to do nothing?
I think,
Because I'm sure you were angry too.
oh, tremendous anger.
Right.
I think it's an approach of protection. It is actually an approach of trying to harness some control,
Right.
and actually is a sign of strength in a different way.
Right.
And that's how I feel myself to be, is a survivor, a strong person, that cares a lot about people and has forged a path of healing myself. And so I believe that healing is possible when people have the right support.
We are here in the community. We partner with our community health workers to run vaccination clinics throughout the city of Louisville, specifically downtown and the West End. The importance of events like these is that a lot of people have transportation issues, so we are able to come out into the community and get people the vaccinations that they need.
So it's really important to have these type of events in the community because, you know, as we know, when COVID and flu season comes around, our underserved communities are hit the hardest. So if we can bring any vaccines or anything that they need, glucose testing, it's important to meet people where they're at.
At Park DuValle, we care about the community. We do events like this monthly because we are the community and we love to give back to the community.
Be sure to visit our website for more of our upcoming community outreach events.
For more information, visit us online at pdchc.org.
Hello, my name is Sierra Clark and I'm the Chronic Disease Manager at Park DuValle Community Health Center. Ever since I started at Park DuValle over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at Park DuValle Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
Have we done anything where we can measure a reduction in stress?
Yeah, so part of what we do is that we measure, we track how people report their own mental and emotional health, how many days they feel like they haven't been doing so well. We use a World Health Organization assessment, and we use validated pain scales.
Okay.
So we're asking questions about how do you feel like you've been showing up in the last couple of weeks in your life, mentally and emotionally? In the last 24 hours, how much pain have you faced? How is pain affecting your ability to do just everyday activities of living? And then we do that pre and post. And so we can see we're getting amazing increase in well-being.
Okay.
Astonishing, actually. And it really is something to investigate further.
Okay.
That the hands-on therapeutic body work really makes a lot of difference for people to feel better.
You know, that's the area I want to go deeper into, to really show that acupuncture and actual massages actually reduce people's stress levels and helps more circulation, blood flow.
Yeah.
Because I think it's critical, especially when you're talking about chronic disease, and it's the area of medicine nobody's really touched.
Right. Yeah. So one of the things that has been shown with massage therapy is that it decreases cortisol, and cortisol is a major stress hormone that's going to be activated in trauma and extreme stress, toxic stress. And if cortisol keeps being released in your body, it actually weakens your immune system. It paves the way for more chronic disease. And so it's actually a really strong preventive measure. If we can decrease levels of cortisol and also impart a skill set that people can engage with at home, you're setting them up for success. You know, you're swimming upstream to prevent things from happening, and you're empowering someone to be engaged in their health too.
So you speak in my language because, you know, most of the time in African American communities, cortisol levels are higher anyway. And most of it is due to racism, and the other part is dealing with the environment that people live in that is very stressful. So have you dealt with anybody coming through that has witnessed gun violence or been involved in that?
All the time.
Okay.
All the time. And it's not even just one simple, someone has lost their son and was shot down the street from their home. It was their economic challenges, and the whole environment is challenging, and past traumas. It's and maybe they have diabetes at the same time. It's a whole series of things happening all at once.
Kind of hard to tell people to eat healthy or go see a doctor in that type of environment, right?
Yes.
So we have some work to do.
Yes. Yeah. And I think that stress and overwhelm and toxic stress, I think, you know, we throw this word stress around so much, you know, we're all stressed out as Americans, and you just push through it and you just get over it.
Right.
But I think that when you look deeper in communities that are under-resourced, that are exposed more to economic challenges and redlining and racism, that there is just a constant bombardment. And so it is so wrong to then go to that person and say, you just need to like eat broccoli and kale and everything will be fine.
Right.
There are structural things in place that need to be dismantled. Thank you. And also boots on the ground work of meeting people where they are.
Right.
You know.
Right. How many locations are you at?
We get recruited by different organizations. So we might show up at South Louisville Community Ministries, Volunteers of America. We've worked with the ACE Project. So there's a lot of pop-up clinics that might go for a month or 3 weeks. But currently, our location at Park DuValle Community Health Center on Wilson Avenue is our most consistent site.
So would you prefer to be at a consistent site so people know where you're at and they can expect you to be there?
Yeah.
Okay.
It makes a difference. I think having that stability, that consistency, that we are showing up, we are here, we're not kidding around. Like we really want to show up and help people, and we're here and available as a resource for people to tap into.
Well, that's something to think about because we have 7 sites.
Well, if we get $300,000, we could expand to more sites.
You heard that. So
you know, it takes resources to help people. You know, and you know, with Tip It Forward with massage is medicine. Massage is marketed as a luxury and as a privilege.
Right.
But it is a very powerful tool that is underutilized in healthcare.
Oh, I agree.
Yeah.
I agree.
Yeah.
So what's in your future?
What's in the future? I think a lot of teaching is in the future. A lot of documenting our model and teaching more people about this work and really wanting to educate people around the importance of therapeutic touch for healing and why it really needs to be prioritized for communities that don't typically have access to the work.
Yeah. Well, my final note, I believe in your cause. I appreciate the work that you're doing. It is a service that this community really needs and really needs to invest in. So we would continue our partnership and investing. Because investing in you, we are actually investing in people.
Yeah.
So I just want to thank you for sharing today. That concludes our show for today. I hope you enjoyed the conversation. Have a great afternoon.